surgical help.
I had that Baker's cyst down behind my knee. The amount of pressure now from, like, literally my knee downward, it's just so painful. I can't straighten my leg now.
So you OK having your bloods done?
I think so.
Do you tend to faint?
I won't look, put it that way.
You won't know, no, but do you tend to faint?
His tears are bloody and there's a bit of blood in the corner of his eye.
OK.
Just pull down your trousers, lie curled up in a little ball on your left side with your knees up to your chest, facing the wall. Are you ready?
Oh, I wouldn't say no to a cup of tea. That would be amazing. Georgina, I have a fund. People put in £5. People just help themselves to squash, sugar, biscuits, chocolate biscuits. There's hot chocolate in there. There's biscuits, mints upstairs. So if you want to join the fund, let me know. Or Heather does obviously the milk fund as well. I don't know how much she charges though. I'm not in the milk fund.
Janet Shaw, please.
Yes.
Hi there.
Hello. I think I've seen you with Janet before. I'm her sister and carer.
I didn't see her there.
Of course, her little legs don't keep up with me.
Well then, come on in.
Come on in, Janet.
Hello, yes.
Hi there.
Well, unfortunately, Doctor, Janet has had skin cancer this side.
Right.
And had an operation.
Right.
But I'm not happy about what's happening here at the moment.
And what has been happening?
Well,
Tell me a little bit more.
I looked today and it was weeping.
Right.
And I don't quite know whether to cover it up or let it just go.
And has it grown at all, or has it just been weeping?
Very quickly.
Has it? So it's grown quite a lot?
A fortnight ago, we went to see the dermatologist on a Saturday.
Oh, right.
She got to have another operation.
I see. So the operation is coming. Did they say what kind of skin problem it was?
I think it's carcinoma.
Basal cell carcinoma is one of them?
That's it.
Is that the one? OK. Have you been in touch with the dermatologists?
No.
We need to get the message back to them, don't we? So that they can then see what they want to do. Can I have a little look?
Yes.
But the other one, it was just warty, like a wart. But this one is like more ulcer.
Yeah. Because I think it does look like a BCC, and they can sometimes get an ulcer in the middle. It doesn't look like it's infected to me, so I'm not worried that there's something else going on, and I will write to them telling them that what size it's got to with the ulceration and the weeping, and otherwise I'll just cover it over. I will see what they can do.
OK,
and ask them to give you a ring. All right?
Bye.
No problem. Nice to see you. You go well.
Bye.
Jolly good. Bye then.
Bye.
Lene, please.
Come on then.
Come in. You're all colour coordinated with your dress and your shoes. Thank you for waiting.
That's all right.
Right, which one are we seeing?
This one.
This one?
Yeah.
You? Do you want to play with the trains? Do you want to play with these? Have a play?
You watch
that one.
with me, yeah?
Right, what's been happening then?
Well, she's been complaining that she doesn't feel very well. But then last night she wet the bed, which is very unusual for her, and she's been going to the toilet like every half an hour to 45 minutes, and she's done 4 poos as well today.
Oh, right, OK.
So, yeah, it's quite unusual for her.
Any diarrhoea at all?
No, no diarrhoea. And she's, I don't know if she understands, but I've asked if it burns or anything when she wheezes, and she says no.
Right, OK.
But it's just more, she keeps saying that she doesn't feel very well.
Right, OK.
I bought you a sample just in case.
Brilliant. Do you think she's had a fever at all?
No, she's been normal, like normal behaviour.
Let's dip this then. Is she had a urine infection ever before?
No.
Hello? No. I'm going to dip this in here. See what it says. Let's just give that another minute.
Okay.
Can we pop you on the bed so I can feel your tummy? Oi, God, you're heavy. Right. Are you ticklish? Yeah. There? There? Right, let's have a feel of your tummy. Does this hurt anywhere? No? That's okay, that doesn't hurt. Fabulous. Okay. Right, do you want to get down again?
Ready? Jump.
Oi.
Good girl. Sorry. Come on then.
See what this is saying. Oh, yes. It has developed. Yes, she's got a urine infection.
Okay.
Okay. Now, what we'll do is, with children, we send their urine off anyway, just in case it doesn't respond to the first lot of antibiotics that we give them, then we know what to give them next. So
Yeah.
I'll send that off. But if she's getting worse at all, you think she's developing a fever, she starts saying she's got tummy ache or anything like that, ring 111 straight away so that they can see her out of hours.
Okay.
And then just loads of water.
Yeah. That's fine.
All right?
Thank you.
And I'll bring this out to you. If you have a seat in the waiting room, and I just need to sort this prescription out, and I need to get the duty doctor to sign it.
All right. Thank you very much. Say thank you.
Bye-bye. See ya. Right, how can I help?
So from Saturday night, I had like really intense chronic stomach pain, and then intense pain again Sunday all the way through the night. So it's basically every evening or earlier, it's just like chronic pain. Sometimes it's like a burning sensation here.
And during the day, it seems okay, or it's gone,
just really
or
sore.
easier?
Yeah, it's just really tender at the moment.
So it's mainly the pain that's bothering you, and you're off your food, you don't feel like eating. Any vomiting?
Yeah, twice last night.
You don't smoke, generally fit and well?
Yeah.
When was the last time that you took any paracetamol?
I tried to take some last night, but I was sick afterwards, so that didn't really happen. And then I got given cocodamol last night, and I was going to take one before sleeping, but then I was actually like quite sick, so didn't take any.
Open wide for me. Big amounts of vomit?
It was just like the little amount of food I ate.
Have you had anything to eat today?
Half a slice of toast.
And that's it. And you haven't really been eating well since Saturday?
Yeah, so yeah, about a slice of toast a day, maybe some natural yoghurt.
If you come and have a lie down here, so you haven't travelled anywhere in the last month. Did you go somewhere before that? It sounded like you may have done.
I was travelling Asia for 7 months.
But were you well after that?
Yeah, really well.
So did you get any tummy bugs or anything while you were out there? Because it's sort of standard.
Yeah, so I got a few there and, like, obviously know how bad that gets, so I wouldn't be going to A&E unless it was chronic.
The pain's worse at night, but it is there pretty much all day?
It's tender now, so, like, if I was in the pain I am at night, I would definitely be like, oh, that's a bit tender there.
OK, that's quite sore for you, isn't it? I'm sorry.
No, it's fine. I'm just worried of what it is.
Hello, it's Cultman Reception.
Hello. Just wash it. That's fine.
Hi, it's Dr. Ramshaw from Hallfield Health Centre.
Hello.
No problem.
The dog really needs a haircut.
They don't do buy one, get one free.
I'll sort that out for you.
Tell me what tablets they were.
Hopefully that should clear it up.
Bye-bye.
See you then.
Bye.
Cheers, bye.
Yes.
OK, all right, in you come. All righty. I haven't seen you for ages.
I know, isn't that good?
Well.
This is about my knee.
OK.
You know, I don't know if you knew, I had that Baker's cyst in the back, and the thing that they wanted to go forward with was injections into the kneecap, and I just really didn't want that because, well, I know a few people who'd had it done, it didn't necessarily work, and from what I'd read up about the cyst, it might strengthen my knee, but it wouldn't necessarily do anything for that.
OK.
And this is filled into such... Because I've been sat with my leg bent. I pull my wheelchair forward like this because I'm so weak down one side. I can't use both hands, really, to wheelchair.
Dragging it with your leg.
And I've been doing it for years. It's just filled up so much I can't straighten my leg now.
Right.
Down behind my knee.
What would you like me to do today, then?
I
will have another look at it.
I'd like to know if we can drain it, because the amount of pressure now from, like, literally my knee downwards and what it's doing on this foot, it's just so painful.
Maybe we'll do this with you on the bed, Alison, actually. Is that all right? Might be
yes.
easier.
It's just so painful to actually straighten my leg. It's...
Yeah, OK. So if you can hop over and lie on the bed on your... probably on your front, actually.
OK.
Have a look at that.
Yeah.
A Baker's cyst is a fluid-filled swelling that develops at the back of the knee. Sometimes it's caused by trauma or by osteoarthritis or some other form of joint problem.
I went to Liverpool last week.
OK.
And it was...
You've had a top-up on your accent.
It's... I have, actually. That's funny you say that. But I got, like, one day in and it, literally I couldn't even pull myself round just anymore.
OK. Swing yourself around. So, I still think it's a Baker's cyst, OK? What do we do about it? I'm not just going to stick a needle in the back of the knee myself, because there are other structures in the back of the knee, and, you know, you could do harm. OK, I'll ask for an ultrasound scan of the back of the knee just to confirm it's a Baker's cyst and there's nothing else going on, all right? Simultaneously, I'll also refer you to the musculoskeletal assessment service for them to advise on what's the best way forward, which I suspect will involve the help of an orthopaedic surgeon. Actually.
OK.
Yeah.
Thank you.
Is that all right? Is that a plan, then?
That sounds
OK,
brilliant.
so I'm just going to write in my book to get those two things done.
I was worried you were going to say, well, actually, steroid injections under the kneecap is the only way forward.
No, I think it's a bit too big for that, actually, to be honest. Yeah. When you go for your ultrasound, you'll get an appointment to the post for that. OK, I'll do those referrals.
Thank you.
Yeah, lovely to see you.
Thank you.
OK, go for yourself.
Bless. Have a good day.
Cheers.
Let's just have a check of that. So there's no sugar in your urine. There's lots of ketones. I'll explain what that means in a second. No signs of infection on this sample. So ketones in the urine means that you're getting a bit dry, a bit dehydrated, and you look a bit dry, a bit pale. So I think we've come to a stage where you would benefit from having some fluids through a drip and some blood tests just to see what's going on, maybe an ultrasound scan. It's not fitting into an appendix kind of picture, but it could be pyelonephritis, which is that you get a kidney infection, but the urine's not always showing anything up. But I think we've got to a point that we need a bit more help with it. You haven't got a temperature or anything like that. Your blood pressure is a bit low. And that's also why I'm a bit worried about you being a bit dry.
Yeah.
Is there anyone who can take you up to the hospital?
Yeah, my stepmom's coming at
All
half
right.
an hour.
You look very upset.
Yeah, I'm just worried.
What are you worried about?
Just that I don't know what's going on.
Yeah, OK. But you're dry, and we need to just pep you up, do some blood tests and see what's going on.
Yeah.
You don't have to wait in the main area. I can give you the side room to wait and make a call.
Yeah.
And I'm going to speak to them at the hospital about this.
Thanks. Cheers.
All right?
Yeah, that's great.
You know there's a water fountain, so it'd be good to drink some water.
Yeah, I'm going to drink some more.
So if I show you where that is, because
Yeah,
I'm just going to make a call. Don't forget your things. All right?
Thank you so much. You've been
That's
really
okay.
helpful.
Just got a lady in here, OK?
Oh, yeah, cool.
Just in there.
Thank you.
That's OK.
Not very good with needles.
Not many people are.
If you want to have a look, that's fine, but just in case it makes you feel a bit funny.
Do you not like looking?
No.
I've got good veins. Yeah.
My best friend's a midwife and she loves my veins.
I find it satisfying watching this.
Flowing well today.
Good sweating.
Oh, you just keep on taking the blood.
Got me sweating as well.
Shan stock. All right, if you just want to come take a seat.
Hi.
How are you feeling? You all right?
I think so. I think so.
Good. Just going to do a quick blood test. Are you OK having your bloods done?
I think so.
Do you tend to faint?
I won't look, put it that way.
You won't. No, but do you tend to faint? Do you think you'd be all right, or would you prefer to lie down?
No, I'll be all right. All right.
Yeah?
I just won't look.
All right. Not many people do.
Is that so? All right, so I'm not abnormal then?
No, I don't look when I have a blood test taken, and I do it for a living.
Okay. So this blood test is going to test all sorts of things, is it?
This is going to test your HbA1c, which is your sugars, full blood count, which will check your red blood cells and white blood cells, haemoglobin, electrolytes, which is your kidneys, your liver function test, which is your liver, lipids, which is cholesterol, and your thyroid.
Right, OK.
So giving you a bit of a...
And all over the thing?
Check-up, yeah.
Right.
Are you OK with plasters?
Yeah. No problem with that.
All right. Okay, I'm just going to wash my hands.
So this is all part of this sort of health check, then?
Yeah.
Yeah.
So this is the reason why we're doing it, is just because it was advised that you needed the blood doing. All right.
That's it, right.
Your BP was done
yesterday.
Last time. Yeah. Oh, it was yesterday, was it? And that was OK.
Yeah.
So that's good. So now we just need to wait for the results of the bloods.
So yeah.
All right.
So...
Which time do we go for when taking bloods?
Oh, let's go for that one, because I can look this way, can't I?
All right. All right. Do you want me to tell you what I'm about to do? No, just go ahead and do it.
Just go ahead and do it, yeah.
All right. Oh, bless you.
Yeah, I used to give blood very occasionally.
Yeah.
And the last time I gave it, I keeled over completely. And they said, oh, please don't come back again. And I said,
really?
well, don't write to me then, keep asking me.
Yeah.
So they haven't since. How much you taking?
Just two small bottles, all right?
2 small bottles? Gee!
Oh, no, not bottles, but like 2 blood vials.
Right, OK. I imagine it's a massive thing now. Is it all done?
No. All right.
All done?
All done.
Oh, fantastic. Yep. That was amazing.
Oh, thanks.
Yeah, no, brilliant. I've been gearing myself up for this.
Oh, bless you.
It's ridiculous, isn't it? It really is.
No, it's not. If you bear with me a second, I can pop a plaster on.
Right.
All right. Don't want you walking out of here leaving a little trail of blood behind. Scare off the rest of my patients, you will.
So the results, will they tell me?
The results will be back in 3 days.
Right, OK.
And we can give you the results over the phone.
Right, OK. No, that's brilliant, yeah.
Let's pop a plaster on for you.
Gee, that was a lot. I got to eat and drink loads tonight, haven't I, to make up for that.
Such a big amount. All right.
Probably stopped, is it?
Yeah, perfect.
Right.
Souvenir to remember me by.
Excellent.
All right.
Thank you so much. Nope, that's brilliant.
No worries.
Have a good afternoon.
And you, take care. Bye.
Thanks. Come along in and have a seat. You OK there?
Yeah.
Right. How can I help?
My tongue is hurt.
OK, your tongue is hurting.
Yeah.
OK.
My throat.
OK.
Burning.
OK, your mouth and throat are burning. OK, yep.
And it like sandpaper.
OK. Fine. How many days? How long has that been feeling bad?
For a while.
For a while. OK, OK. And are you feeling well in yourself otherwise?
I'm low emotionally.
Just say that again.
I will write it.
OK, OK. I didn't quite catch that bit, so that would be helpful. OK, so you're a bit low in yourself. Yes. OK. Shall I have a look at your throat in the first instance? Actually, I'm going to start off by just checking your temperature. So, can I put this in your ear to check your temperature? OK, that's great. That's fine. That's not no fever.
Okay. And now let's have a look in your throat. That's great. And just say ah. Ah. And again. Ah. Fantastic. Okay. I can't see anything, any muck in the throat. Let me have a little feel. Can I just feel your neck?
Yeah. This is about
That feels sore there. Okay. So are you able to eat? Okay. I think, as I say, the throat looks okay. I can't see anything particular in your mouth, but I think if it's feeling sore and it's feeling like sandpaper, something that might be causing you problems is thrush. That can make your mouth feel very uncomfortable. It's a very simple treatment. And then if that doesn't help, you can come back and see us. I'd give you a week's course and see if that would help. Okay. The other thing you said was feeling quite low emotionally. Do you think that's tied up with your mouth getting you down, or is that a different thing?
Different.
Different thing?
Yeah.
Okay.
Different thing that I'm a human being.
I think I'm going to need to get you to write that bit. I didn't quite understand. Oh. That's how you feel, that some people are disregarding you as a human being?
I'm a human being with a disability.
Yes.
Well, the disability is not the hard thing.
Okay.
Take a seat then, OK?
Are you ready then?
It's a digger, isn't it? I'm not digging that at all. No, I can't bother with that. What about this one? He's riding a kangaroo.
Hugo, please.
Come on.
Hiya.
Hello, how are you? Hey, how are you doing?
Yeah, good, thanks.
Good.
Hiya, so what's been happening to you then?
Hugo fell down some stairs this morning. He was coming down the stairs behind me, and I turned around to like pick some wet wipes off the stairs, and he just like came down in front of me, and so I caught him on the rebound. I don't think he was that far behind me, so I think he maybe fell down a few steps straight down onto his head. And cried a bit.
Sure.
And then stopped crying, and I thought, this is cool. But then I noticed there's a bit of, like, his tears are bloody, and there's a bit of blood in the corner of his eye.
Okay.
So they're like carpet-covered wooden stairs, and he cried for...
And he landed on the stairs rather than on a stone or anything harder?
On the stairs, yeah. On the stairs, yeah.
But he hasn't been sick or had obvious problems with his vision or...
No, he's been really perfect.
Using his arms and legs all normally?
Yeah, everything
Eating
fine.
and drinking
yeah,
fine?
It's normal.
Just got this bit of blood since
yeah.
then. Hello.
He might have stopped now, but it was
Can I
there for a
prod you?
while.
Can I tickle you? Right, let's have a little look. Look over here. Good boy. Look over here. So his eye itself seems absolutely fine, doesn't it? Just a bit of bruising just underneath.
Yeah.
There is just a little bit of bruising just under the eye, and I think you're right. I think he's just got a little bit of tiny burst blood vessel there. In fact, right in the corner of his eye, I can see.
Yeah, that's where the blood was coming from.
But the eye itself looks completely fine.
Yeah.
And he's moving it around completely normally, and he's following, and he's obviously interested in, you know, obeying my instructions and doing everything he should be. So that all looks fine. Let's just shine a light in it. Good boy. Can you smile for me? Give me a lovely smile. Can you give me a smile? You've already shown me that you can do a nice smile, so I'm not too worried that there's anything else going on there. I think my sense is that he's just got a minor head injury from this fall and that this is nothing that we need to be worried about. I think he's going to get a little bit of a black eye, and you know, that's okay. What we don't want to see is him vomiting, him having obvious visual problems, getting drowsy. Those are all the sorts of things we get worried about with head injuries. Obviously, if he had a fit or started getting drowsy or you were worried, then bring him straight back and we'll do something more. Then we'd need to get the hospital involved. Yeah. But, you know, head injuries are really common in children, and as long as they're minor and we're not worried that he's done himself any major mischief, which is the case now, then actually we can just keep a really close eye on him and he'll just get on with life as normal, I'm sure. Thank you. Does that answer all your questions? Super job. And obviously just some Calpol.
I really wasn't worried. I mean, if I thought anything was really bad, I would have gone to A&E, I suppose. But
super job. Nice to see you then.
Thank you,
Bye. You going to give me a wave? No.
Say bye-bye. Say thank you.
Bye.
Good boy. See ya.
Bye-bye.
Okay, so you have a disability, but that's not the whole thing. Yes. Okay. Okay.
And
so you feel everything is put down to disability. And that's not how it feels. Yeah. That's.
And I'm supposed to be having some counselling.
Some counselling. Okay. Okay.
But nothing seems to be happening.
Okay. This is going back a little bit, but there was a plan for you to have a scan of your head. Has that happened?
Yes.
Okay. And do we know the result of that?
I don't really understand it.
Okay. Let me just have a quick look. Let me have a look at the last letter. Well, here we go. Right. They found something very, very tiny that they want us to monitor. It's that the presence of this little something in the pituitary gland in the head, they suggest that it's not a good idea to prescribe you medication that they had considered because it's there, and that you're to have annual, yearly blood tests to look at the prolactin, which was that hormone that was found to be a little bit high. The main role it has really is in breast milk production, but it is also important in terms of regulating the periods as well. But I think though yours was a little bit high, they've sort of found that there's just a little tiny area within the pituitary that's producing that little bit too much of it. Yeah. Okay. I think what I'm going to do now, because I'm slightly running out of time today, is to leave a message with Dr. Clark to just ask her whether or not we need to do any looking into your counselling. Okay? Okay, so that's a prescription for your mouth. And let's see if we can get that feeling a bit better for you. All right. There we go. Yep. All right then. Okay, nice to meet you.
Nice to meet you.
Okay, take care.
Bye.
Bye-bye.
Oh, it's you.
Yeah, you.
Good. Just finished?
Well, yeah, in a second.
Oh.
I had a card today. I'm really chuffed with it. Oh, it meant so much to me. I'm patient, but it's really, really nice. I cried.
Oh, what? So thank you. Oh.
Yeah, so I'm chuffed.
Look at you.
So when she gave it to me, I was like, there's just tears, so we just come in.
I was like, you soppy thing.
It's so nice.
Have a seat.
Oh.
How can I help?
My bladder.
Your bladder, yes.
I'm now peeing, since I don't sleep.
Yeah.
It's hard to say, but every hour.
Yeah.
Day and night.
Right.
And sometimes even more than that.
Why do you think you've got a problem with peeing?
I have no idea.
So often?
I pass a huge amount as well. It's not like a tiny bit. It's like, you know, pint.
Really?
Yeah. And I just don't know where it's coming from.
Do you drink quite a bit?
I drink a lot of tea.
Yeah. How
when
much?
I'm working in the night, maybe 2 cups of tea in an hour, say, perhaps.
So do you drink 2 cups of tea every hour overnight?
Yeah.
So that might be that you're drinking 10 to 12 cups in 24 hours of tea.
Yeah,
at
definitely,
least.
definitely.
Yeah.
Yeah.
What about coffee? How many coffees in 24 hours?
Maybe 3.
Any other fluids apart from tea and coffee, or is that your main
Water.
fluid intake? And how many cups of water would you have in 24 hours as well?
4.
Okay. So when you add all that up,
Yeah.
And if you were to do a sort of fluid balance thing, and you were to look at how much fluid you're taking in and how much you're peeing out, it may not be that different, but the difference is that at the moment you're awake all night, which you aren't normally, or you aren't always, shall we say. The problem with tea and coffee is they've got caffeine in them, and that makes you pee more.
Does it? Right.
Definitely does, yes. OK? So that one of the things that you might find helpful, whilst we try and work out what the matter is to get some decaffeinated tea.
Yeah, I could probably drink... Leslie drinks decaffeinated tea.
Does she? Yeah. OK. Well, why don't you switch to that in the first instance, see if that makes any difference.
That'd probably be all right, because it tastes...
OK. How long do you think things have been worse for with your urinary frequency and urgency?
6 months.
Are you worried that there's something a bit more significant going on?
Not because you told me that, you know, you've examined my prostate
Is that
relatively recently. Well, I came in and you told me you'd done it the year before, I think, last summer.
Here it is. It was June 2015. But I guess we could do it again because it's changed so much in the last 6 months. Do you see what I mean? Do you want me to do that now?
OK. No, it's fine.
Get it done?
Yeah.
Yeah, just to see whether your prostate has got bigger. So I think, but we ruled out diabetes. So I think I should examine you, you should have a blood test done, and then we should discuss the result and work out what we're going to do next. But I think if you reduce your decaf, you might be a lot better.
Lifestyle change.
Yeah, you're good at that, sometimes.
What does it mean?
Reducing the amount of caffeine. Just pull down your trousers, lie curled up in a little ball on your left side with your knees up to your chest, facing the wall, OK?
There's a big fuss made about this test.
There is.
Which I think is silly.
About which test?
This test.
Oh, having...
There's nothing horrible about it. It's perfectly
not too
fine.
bad, is it? No. Are you ready?
It's the next one, yeah.
It's the next one?
Yeah. Putting a camera or whatever.
Yeah, that's absolutely normal. You have not got a big prostate.
Good.
OK? Now, don't fall off as you get dressed, because it's a really unusually narrow bed, OK? OK, so unfortunately, we haven't got anyone who can do bloods today.
OK.
But I don't think it's urgent. I think just have the blood test done in the next couple of weeks, OK? That's for you to have a read. Is that all right?
Yes.
Today? Yep. Great.
Cheers.
Very good. Bye.
Hi, how are you doing? We're right down the end of the corridor. A bit of a long walk. Nice bit of exercise. Come on in, take a seat.
Okay.
Right. You okay there?
Yeah, fine, thanks.
All right. So, I was just looking at your notes from last time, because you saw Kaylee, didn't you, last week?
Yes, I did, yeah.
And you weren't feeling too good, were you?
No, I don't know what it is. I think I've got conjunctivitis as well. Some stupid thing going around in my head.
Your eyes look okay. Do you want to take your glasses off? Let me just have a look.
Yeah, sure.
Are they very weepy? Are they sort of crusty?
Just a film across them.
Right. When you wake up in the morning, is no crustiness or...?
No, that's not there.
They look absolutely
They look
fine
all
at
right.
the moment, yeah.
It's got to be my glasses gone wrong. I need a new pair,
Yeah.
definitely.
Would you like me to give them a little bit of a clean?
Please, they've been through the wars with me.
Yeah.
So I don't want to get rid of them.
So are you
but
feeling a bit better now?
Oh, yeah, from that, yeah, I am. I blamed whatever I had on my eyes as well, mine, but I blame everything on that.
Try that.
Yeah, thank you. That's because these are designer. I paid a mint for them. Oh, that's see everyone now.
Is that better? Is the filminess gone?
Yeah, there. I'm a bit undaunted now.
OK.
Oh,
so let's have a look at your leg. Is it...
Yeah, I've got my new stockings have come through. Sorry I didn't bring them in today.
That's all right.
I did change it the other day.
OK. Just pop your foot on the tissues for me.
It's on a leak.
Yeah. Because, yeah, usually we put a big pad on, don't we?
Yeah.
So you changed that, did you?
Yeah, it leaked the week before. It leaked everywhere. And that should be under the foot as well, that dressing that you just Just taking off that long yellow line.
Yeah.
It's not very nice there.
It looks like it's half off this one anyway.
I think that's going to need a bit of dressing help.
So it's not oozing any liquid, is it?
Our nurses are the experts as to what's the best dressing, so we'll go with their advice.
All done.
Lift your foot up, just so until you hit that. Have you still got your lodger with you, or?
I do, yeah.
Yeah.
I do.
Does that work out? Or...
He's gone away. He's gone. He's a kind of carer, so he's only sort of part-time with me.
Oh, yeah.
Yeah, he's gone away.
Oh. Does that feel okay?
Yeah, very, very nice. Thank you. That's it.
Yeah?
Yeah, that's fine. That's lovely.
You sure?
Yeah,
You in?
that's lovely. Yes, thank
Don't
you.
be tripping up. Well, it's nice to see you, Linda, and...
Yeah, thank you very much. So,
No worries. You come up with me now.
OK, thank you.
We can...
OK, that's lovely. Thank you very much. Yeah, thanks very much.
Gonna be... Riley Warner? Oh, that's me. Sorry, I'm so late. I'm late anyway. Have a seat. I'm absolutely boiling. Right, what can I do for you?
Well, firstly, I wanted to get another prescription of the pill.
Right, OK.
But then I also have been looking at getting the coil. Because
OK.
I'm not very good at taking it regularly.
It's a good reason to consider something else.
Yeah,
Yeah.
because I did have the implant and I didn't really like that.
Yep. No, it's a really good option. So, have you looked into the two kinds of coils?
No, I haven't.
Right, OK.
That would
Right, so there's two kinds, two main types, OK? One that has a hormone and one that doesn't, that we call the copper one. So the simple one is the copper one that works as a contraception, as a device in the uterus, OK? And it releases copper that stops you getting pregnant and stops implantation. So it's very effective.
Yeah.
The downside of the copper one is, or it could be, not with everyone, it can make the periods a bit heavier. So the hormone one, OK, we fit it the same way, but it releases a small dose of progesterone. OK.
Yeah.
So we suggest giving up to 6 months to let it settle down. So when I say settle down, I mean you might get irregular bleeding.
OK, so it might be a bit kind of
all over the place, but then it often does settle, and in many people you get either very light occasional bleeding or nothing at all.
OK. Yeah.
So the other thing to chat about is how we insert it. So have you ever had a smear test done?
Yes.
Yeah, so it's a little bit like that, OK?
In the same kind of procedure.
Yeah, exactly. So the doctor does it with the assistance of a nurse, OK? So it takes about 10, 15 minutes. So when we put the coil in or when we're using the other instruments, there is an increased risk of perforating the womb.
OK.
So that's a risk of about 1 in 1,000.
OK.
There's a risk of infection. There's a risk of it coming out. OK? If you had a very heavy period or something like that.
Just check it.
Yeah.
OK.
Yeah. So the other difference is the copper can be inserted for 10 years and the hormone one is for 5 years.
Wow, OK.
Yes.
That's quite long.
OK. So shall I give you some information about them?
Yeah, that would be great. That would be really great, please. Yeah, I don't think there's any other questions. I'll read this and
yes,
probably
so have a
loads
read.
of questions
yeah, well,
afterwards.
That's fine. Just give us a ring and
OK.
we do telephone consultations so I could chat to you.
Oh, OK. Oh, yeah. That's brilliant, yeah.
Okay.
Thank you.
So in terms of your pill at the moment, so should we just give you some for now to be going on with?
Yeah. Maybe give me another month or something.
Yeah,
Just,
OK.
Just so I've got... Just in case.
Yeah, no problem. You can have it fitted any time of the month, really, as long as you're definitely not pregnant.
OK. Ah, that's good to know. Yes, thank you.
Yeah, no, it's a really good form of contraception. You can have it removed when you need to. Those leaflets are quite good, so have a little read.
Thank you very much.
OK, no problem. Well, good luck on your decision.
Thank you very much.
OK, no problem. Bye-bye.
Freddie, please.
OK.
Hello. Don't recognise you from it. I think you've changed your hair or
Yeah.
held it back. Hello, Freddie. Sorry, it's not... This is about you, isn't it? Let me grab another chair. Okay. There we go. You seem to have grown.
Yeah, getting bigger.
Oh.
So, do you want to tell Doctor first, or do you want me to?
You.
So Freddie's just started having a stammer.
Right.
It's not all the time, and he's always sort of had it there, but lately it just seems to be getting worse.
And so how long ago do you think this started as a thing?
Quite long ago. But it's just getting, like, worse and worse.
There was a time when it didn't happen at all?
Yeah, you didn't always have a stutter, did you? Like a stammer.
No.
Are there times when it's more likely to happen?
It's mostly when I'm speaking to lots of people as well.
Does it happen at home?
Yeah.
Yeah. So mum, you hear it.
Yeah.
Yes. Okay.
You know, it might be 3 or 4 times a day that he'll do it, but and then other days it'll be like constant, and he's really getting stuck, and he laughs at it.
Yes.
But I think at school he gets quite annoyed at himself sometimes, don't you? Although, you know, I think his friends are quite good about it as well.
Yeah. Good friends.
Yeah.
Yeah. Good. Anything else that's upsetting you anywhere in your life?
No.
No. Okay. You're getting on all right in school. Do you work hard and do all right?
Sometimes.
Okay.
No, he's pretty good, I think.
Yeah.
You do get quite anxious sometimes, don't you?
Yeah.
If you are a bit anxious, it's more likely to happen.
Yeah.
So you're obviously, here with your mum, feeling
But
quite
Freddie
calm.
does suffer sometimes, and he did suffer with panic attacks.
Right.
Back in, was it about a year ago or so? And I know I spoke to Mind. Is it Mind?
I see.
And we did like a worry box.
Fine. Okay.
So all his worries we used to put in a box.
Yeah. I mean, it's interesting. It's obviously not there the whole time, and it wasn't there always. And that encourages me that actually this isn't going to be a thing that you're going to have
that's what I'm
lasting, ongoing
thinking.
problems with. The thing we do is to ask what we call a speech and language therapist to see you. So they're people who specialise in speech and language, so in the ability to communicate. And they do look at this as a problem. Do we need to do that yet or not? Maybe have a think about that. And if actually you get home and think, well, no, I do want something done about it, I will make that referral. But I also don't want to...
No, maybe we'll leave it for a bit longer then and just see.
Yeah?
See if it calms down.
Do you want me to give you a list of sort of resources you could look up?
Yeah.
Yeah? Patient.co.uk or NHS Choices.
Thank you, Doctor.
Okay, lovely. Very nice to see you.
Yeah, nice to see you. See you later.
Bye, Freddie.
Bye.
Bye.
Nice to see
It's
you.
been nice meeting you.
You too. Bye-bye.
Bye-bye.
See you later.
Alligator.
In a while, crocodile.
Thank you. That's the plan. Great. Cheers then. Bye.
Thank you so very much for seeing
That's all right. Nice to see you.
Hello, sweetheart. Bye-bye. Enjoy your... Yes, you're gorgeous, aren't you? Bye-bye.
Good morning, the Ridge Medical Practice. Vicky speaking.
Try not to bite my finger off, OK? I need it for work.
Do you know why I would like you to stop smoking?
Because of my chest, I know.
Do you feel like harming yourself?
Not right now, but you never know, do you?
It's funny how you've been well all through your school holidays, and then day you go back to school, you get poorly.
Your sugar now.
Pre-diabetic.
Yes, you're getting a gold star.
Woohoo!
Morning, Emily.
Morning.
ready for us?
I am, yes.
Sorry.
I've just dazed off and gone on to something else.
It's quite all right.
Come in.
Hello.
This is Betty. Hi.
And I'm Jane. I'm looking for a daughter-in-law.
Oh, right, OK. So they seem to say you had a few bits and pieces that they wanted us to
it
check.
started with that about 5 years ago.
Oh.
Then that.
Right.
And I've had put Germolene on every day, but it hasn't moved it.
Right.
And then I've got all sorts.
You have, haven't you?
Yeah. And I've got one behind there and that itches. Can you see it?
Yes.
And then I've a few. One on my shoulder there.
And then on your face. This
Oh,
one.
these are mostly, I won't
They
get rid of
started.
these. I'm not bothered about
You nearly forgot about them, didn't you?
And these, I mean, these are driving me mad. There's one behind me here. And that cheek there. And the touch on my forehead there.
Oh, goodness me.
But I won't really want these on my face. I mean, my beautiful face, you see.
So can I have a look at them? Sorry, this is a bit of gel.
Oh, of course you can.
Yeah, and a bit
I
of a
just
light.
want rid of them on my face.
I've been feeling,
Poorly?
yeah.
Yeah. Any high temperatures? Have you felt hot?
Yeah, she had a temperature this morning.
Did it wake you up in the night?
Yeah, as well.
What kept you awake?
In my throat.
Was it really sore? Okay. Shall we have a look at it? Come on then. Were you going back to school today? Is this a big drama to get out of school, do you think? It is a drama to get out of school.
Better not be, Halima.
No, in here. Let's have a look. Oh, your temperature's high. 38.3. Right, give me a big R. R. Oh, it does look sore in there. You go and sit down. So you have got a bit of an infection in your throat there. We'll give you some antibiotics and you can go back to school tomorrow.
Okay.
How's that?
Good.
Good for Dad.
Good.
It's funny how you've been well all through your school holidays and then day you go back to school, you get poorly. I believe you. That thermometer doesn't lie. Drink lots and lots of water because your lips look a little bit dry. We don't want you turning into a raisin, do we? What if you wake up tomorrow morning you're a raisin? Can't go to school then, can you? Put you in some scones. That's a good idea. All right, darling. I'll see you next time. All right.
Mate, take care. See you later.
No worries.
Sorry, what made you sort of come now? Have you suddenly got a load more?
I've been
or
telling
what?
the doctor about this for years.
Yeah.
And he said you'd better go see a dermatologist.
Yeah. What about these on your face? How have they sort of progressed over the past 6 to 12 months?
Sometimes bits drop off.
Yes. That's not anything to worry about. But still, we want to try and treat them, and I'm just trying to think how's the best way to do it. So you've got a lot of different bits and pieces.
Yep.
I think that they are mostly sunlight damage. I was wanting to get the advice of our consultant, and she's here next week. I know it's a bit inconvenient to come back, but I'd just like another brain to help me suggest what to do, whether there's some that she thinks she's a bit more worried about and perhaps we should take a little sample, and whether there's others that she'd just be happy to put some creams on that will irritate. So they'll go quite nasty and crusty, and then it starts to come back beautiful again, but without surgery.
It'd be nice if it were ointment from my face.
I know.
Yeah.
Well, it wouldn't be nice while it was working because it'd get really crusty and it'll look a right mess. No, but it doesn't matter because after a couple of months it'll look beautiful again.
Oh,
so
yes.
that's what you want, isn't it? It's a full facelift. Okie doke.
Thank you very much.
You're welcome.
Lovely.
Okay.
Thanks for your help.
Thanks. Take care then, so I'll see you next week.
Yeah. Yes.
Turn right. Turn right.
Bye.
This way.
Oh, I'm going the wrong way.
I've got a really, really, really big spider. Oh, wow, it is a big one. Look at it.
Oh my God. It's a monster shell.
It is. Now I need something to shimmy underneath. Come on, mate. Ooh, look how big he is. Whoa, oh my God. Absolutely huge. I'm gonna just go. Let's go for it. There you go. Ugh.
Hello, good morning.
Hello, Ahmed.
How are you?
What can we do for you today?
Well, basically, I need some balm cream for my leg.
And what's the cause of that?
I fell and scraped my leg on a door.
Right.
And it flared up and everything, you know. I mean, that's 2011.
So quite a long time ago.
Yeah. It's still there, the marking, because when I'm walking, especially when I'm doing a bit of exercise, the blood's flowing, then it gets really itchy. I mean, as you can see, the skin gets really dry. And it starts flaking off.
And has that colour and appearance changed over the last few weeks, few days?
No.
No, fine. Have we tried any steroid cream on that?
No, I don't believe we have.
Why don't we try that?
What will that do? Will that help the itches?
Steroid creams reduce inflammation. So when things are irritated, then it kind of calms them down. So I'm hoping that that's going to improve the itching.
The other thing, right, any chance of getting a full MOT done on myself?
So you're 51. Have you had, anyone over 40 is entitled to a one-off NHS health check MOT.
No.
Have you had it?
No.
So you can book in for that?
Do I need to book in?
Yeah, but just use the words health check, NHS health check. Right. And then what they do is they check your blood pressure, cholesterol, height, weight, give you a kind of once-over.
Right, that's fine then.
Unless there was a particular concern that you had, you just,
I mean, to be honest with you,
general MOT, but...
Yeah, I mean, to be honest with you, I do get some pains in my chest now and again.
Really?
Yeah.
Oh, you should tell me about that. Don't just have an MOT. No, you should share that with me, please. Tell me.
Yeah.
No. You do the exercises, don't you? Yeah.
Exercises are the way forward.
Are you doing any stretches? Weird movements, yeah, okay. Can you just pop your arms out again for me?
And your legs rotated a bit, and she cried.
Oh, dear me.
I'm tired, Janet.
What have you been doing?
Nothing.
Nothing.
Sometimes do nothing makes you more tired.
It does. Come in. Hello, come in. Mr. Hussain.
It is.
Come and have a seat.
Thank you.
I have a student with me as well today, if that's okay.
That's no problem. I seem to be getting a lot of pain. It's been like just over about a week and a half. It's like all back of here, all my arm, and it seems to be, you know, like within the muscles. I mean, as soon as I press, I can feel the pain.
Okay, and anything trigger it that you can think of? You've not moved house or lifted heavy stuff or...
If I did do, I mean, I'm more right-handed. I would have done something with my right hand, you know, not my left.
Okay, let's have a look then, shall we? So, if you just stay sitting for a minute. Is it tender up here?
Yeah.
Whereabouts? Is it?
Well, it's more
at the back?
Yeah.
I could do to have a look at this shoulder. Do you think you could take that arm out your T-shirt? I'm conscious of you.
And can you tell you the truth? You know, when I'm sat down not doing anything, you can feel the throbbing more, you see. That's, you know, really tender, you know.
So can you lift your arms up in front of you?
Yeah, I mean, I can lift them up. I can feel the pain hurting more when I try to lift it up more high.
Can you lift right up to the top? And that's hurting here in this muscle?
It's hurting all the way along here.
OK. Can you lift your arms out to the side?
Yeah, I mean, I've tried all this at home, you know, just to kind of try to ease them off.
So from looking at you, you can put your arm back in your T-shirt now. From assessing you there, I don't think this is the shoulder joint. I think you're right. I think it is a muscular pain. Perhaps you need to have a think about what could possibly have caused it. But the main thing I would say is give it some time. Give it a couple of weeks. And if it's still there in sort of 4 to 6 weeks' time, come back and see us. But I would expect it will go.
But what would cause it going all the way right down?
So you've pulled muscles. You've pulled the muscle here in the chest, and you've also pulled some muscles in your arm. How? I'm not entirely sure, but it seems to me like you've strained some muscles, maybe by lifting a bag or... I don't know. It can be quite a fine balancing act, getting it right between not being dismissive and listening and understanding patients' concerns. In primary care, us general practitioners are gatekeepers, and it's okay to watch and wait sometimes and not jump to investigations straight away.
It just kind of hurts a lot, you know.
But I wouldn't worry. I'm confident it'll settle. OK.
Yeah.
All right, then.
OK, my
OK,
love.
thanks very much.
OK, man. OK, thank you.
Take care.
OK, my love, thank you.
Bye-bye.
What about these chest pain?
It's just sometimes it's difficult to breathe, you know, on the left side. When I'm breathing, you know, it's painful.
It just catches you?
Yeah, it just
when
catches me now and again, yeah.
What about if you're really pushing yourself physically, rushing around?
I haven't really had much of that, to be honest with you. I don't get pain. It's like, you know, you get a stitch.
Oh, okay.
You know, it's that type of thing, you know what I mean? Okay. And when I'm breathing, you know what I mean? It's quite painful to breathe.
And how long has that been the case for?
About a couple of months now, really.
Do you smoke?
I do smoke, yes.
Okay, all right. So do you have a kind of chronic phlegm, cough, or...?
Just normal white phlegm.
Right, okay. Yeah, it doesn't sound like angina or heart pain.
Right.
It could be a bit of lung pain, or it could be a little bit of muscular pain.
Right.
I don't think the MOT is going to help that. But book in anyway. Yeah. Because they check you for diabetes, they check your cholesterol, check your blood pressure.
Yeah, I mean, my mother's diabetic and so is my father.
Yeah, and you're a man and you're 50-ish. Yeah. And you're Asian. All of these things put you at higher risk of having heart disease. I mean, obviously the fags won't help.
No, they don't actually. You know what I mean? I'm trying to reduce them as much as possible and hopefully, you know, come off them, but it makes it very difficult.
Okay, excellent.
Right, thank you very much, Dr. Youssef.
My pleasure.
Thank you.
Bye.
See you.
What? Oh. Mrs. Kirby, please. Have we a Mrs. Kirby? Oh, bloody hell. Mrs. Ingham, although you're not on my paper list for today, my computer has all of a sudden woken up rather groggily, and your name is on my computer list. Anyway, come and let's both fight with your computer, shall we?
Computers are great when they're well.
Here we are.
Come on in.
Hi, Tatiana. I'm Dr. Carr. Nice to see you. Come and sit down. So I believe I'm seeing you for something on your knee. Yeah, okay. How long have you had that for?
I have a couple years already, but before I even came here, but it was very little and it's now growing more.
Yeah.
And that's why I'm all the time with babies. I'm staying on the knees and it's make pain for me.
Yeah, of course. Do you mind if I have a closer look?
Yeah.
The only bit you'll feel is a little needle going into the bottom of it and putting some medicine underneath it to numb it. After that, you shouldn't feel anything at all. We then make an incision over the top of it and it should just come out and you'll have 2 stitches which will dissolve themselves over the course of a week. And you might be left with a little scar where it's been, and otherwise...
Maybe better.
Maybe a lot better than what it is now, yeah, definitely.
Yes,
happy to get rid of it? Good. Right.
So if you make yourself comfortable on here...
Do I need shoes off?
You're okay, it's fine. How old's your baby?
Oh, 8 months now.
Oh, how nice. Is it your first one?
No, third one.
Third one, wow. How old are your other 2?
6 and 2.
Oh, you are busy
Very
lady
busy.
then. Yeah. Are you nervous? Don't be nervous. It'll be all right.
So I'm Susan Towers, I'm a GP but with an interest in skin problems. That's why it's Sister Eve, wasn't it, that sent you here?
Yeah.
Linda.
Linda.
Okay. She said that you've been having trouble with your face for a few years.
Yeah. It's been after the birth of these twins.
We're blaming them, are we?
Yeah. No, actually, everything was right. Everything was okay. My face was really good. But it's been last 2 years I am having this problem.
Right.
And I am having it just before my period, every month. Sometimes every month, sometimes every other month. Can you see this spot?
Yeah.
All around my face.
Yeah. Is this a good day, is it?
Yes, it's really, really good.
Well, we can definitely do something for this. This is acne, and in some people it does start later on in life. It usually starts in the teens, but in some people who are unlucky it can start in the 20s, 30s, even 40s, and then it's much more stubborn, unfortunately. So sometimes we need to use quite strong treatments. The problem that you've got is caused by your grease glands being too active. They're making too much grease and the gland itself is getting blocked. Okay. So when there's too much grease in a gland, sometimes you can see it like a blackhead.
Yeah, blackhead, whiteheads everywhere.
Whiteheads, exactly.
Yeah.
And then sometimes the gland sort of stretches and stretches and gets very inflamed and red, and that's those red lumpy bits that you're describing.
Everyone this pop.
Yeah.
Oh my God. Sometimes at night,
Really
sometimes
sore.
in morning.
What I'd like to suggest to you is this strong treatment called Roaccutane, which really shrinks the grease glands and makes them small again. It's the only treatment that does that.
Okay.
One thing that's important is you can't take this if you could be pregnant or planning a pregnancy in the next few months.
No, not at all.
No, not at all.
No.
Because this tablet always damages a baby as it's growing.
Okay.
So that you would be advised to have a termination. So it's really, really serious. Okay, so that's one thing.
Yeah.
It can also affect your mood in some people. It's very important for patients to understand the potential side effects of prescription drugs. It's a bit of a contract between us and the patient. We need to think about whether it's safe for them to take that medication, if there's other things that might interact with it. Most medications are taken safely and without any significant side effects, but if there's some particular medications which we think have a potentially serious risk for an individual, then it's important that we talk about those. Sorry, I just have to ask that personal question again. If you're sexually active, you must use 2 methods of contraception because this medicine so often damages growing babies.
Okay.
But just bear it in mind. And each time you come, we'll need to check a pregnancy test. So don't be upset that we're asking you to do a pregnancy test. It's just what we've got to do. Okie doke. So we'll be seeing you probably in 4 weeks.
Okay, thank you.
You're welcome. Thanks. Take care now. Bye-bye.
I'm just going to test it. Tell me if this feels sharp.
No, I feel that you touch, but not...
Yeah, nothing sharp. That's fine.
No.
You'll feel a bit of pushing and pulling, and that's normal.
Yeah.
You know, Tatiana, I'm opening this up now, and it doesn't look like a cyst. It looks like a bit like if you got something in your knee, like a piece of wood or metal. So
Like something inside.
Yeah. Often people get like a little chip of wood or a little chip of metal under their skin, and then you can form a granulation tissue around it, and it forms this hard surface like this. So I suspect that's what's happened. And it's in one of those positions where you're likely to kneel onto something, and it...
Yeah, when you touch, it's like a little ball inside.
Yeah.
You know? It's not...
It's okay, we'll get it all out. It's not a problem.
You okay?
It's nearly done, yeah.
Is it hurting?
No, no.
All right.
It's all right.
Really doesn't want to leave you, Tatiana.
No, it likes being in there.
It's quite at home here. Right, it's gone. We're just going to put the stitches in and then we're done. All that for that. You have a nice smooth knee now. You'll have a bit of a bruise where it's been, but it's all gone. And Karen, I'll just put a little dressing over it, and that's that.
I'll just lower the couch.
Thank you very much.
No problem. In a week's time, it'll look beautiful.
Okay, thank you. Thank you.
Hello.
Hi, are you okay?
I'm fine, thank you. Sorry to keep you waiting. How is your dad? How is he feeling?
That medication you give him isn't working at all. So we've had a lot of down days. He don't go out or anything now. He's just enclosing himself in house.
Okay.
So from last time we seen you, it's just got worse.
Okay, he doesn't want to leave the house.
Yeah, he tries to enclose himself.
Okay.
He's fell more into depression and anxiety and feels more worthless.
When you say worthless, is he trying to harm himself?
Yeah, we had to ring first response unit and they said they're going to send him an appointment out.
About 4 times a day they're ringing.
Yeah, they said they're going to send him an appointment out for mental health team because he needs to be assessed. But I told them we had an appointment with you today and they said that it'd help if you could refer him to mental health team as well.
So they want me to refer him to the mental health.
Yeah.
Okay. Do you feel like harming yourself?
Not right now, but you never know, do you?
Okay.
Anything could just trigger it. It's what goes on. It's what the voices he's hearing in his head and stuff.
Oh, is he there? Is he there? Oh, he is, and he's got blue eyes.
Brain surgery. Well, there's no brain there.
That's naughty, isn't it? Hey, look at you. come in. Right, so which one's Hardy?
Hardy's this one.
Yes.
He had been diagnosed with hand, foot and mouth.
Yeah.
So that's...
How is he doing after that now?
He's not been too well, you know. He's, it doesn't seem to be picking up. And, like, his mouth is always sore. And it's still, like, I can see a few spots in there.
So is he eating and drinking?
He's not back to his normal pattern of eating and drinking since the hand, foot and mouth.
Yeah.
But when he does eat, sometimes he'll complain like, ow, that hurt.
Okay. Did he have any ulcers or any skin problems anywhere else when he had this?
He had some spots on his hands.
about
They've
his
all
feet?
cleared up, and on his feet.
And if that's all better
There's one
now?
little scar left, but it's all cleared up.
Can you take his top off for me? Hardy, can I just have a listen to your chest, sweetheart? I know it's not nice coming to see the doctor, is it? Good boy. His chest is lovely and clear. I'm just going to check his temperature quickly. I'm just going to pop this in your ear, sweetheart. It shouldn't hurt. That's perfect. Can you open your mouth for me, darling?
Go ahead.
Ah. Ah. Stick your tongue out, like really naughty. Be really naughty and go,
How do you go like this? Good boy.
Ah.
On that side as well, I saw the spot. Don't know if you can see him now.
I'm going to put my finger in your mouth for 2 seconds. Try not to bite my finger off, okay? I need it for work. Can I just have a feel, my darling? Does that hurt?
Where's it hurt, Hardy? Oh.
That's fine. That was good because he opened his mouth. He's got a tiny, tiny ulcer in the back.
Is it just the one?
Just the one that I can see. The throat doesn't look inflamed or anything. I can't see anything that worries me. So it can take a bit of time for these ulcers to get better, especially the ones in the mouth. Have you tried to use anything?
Bonjela.
Yeah, and is that helping?
Not really.
It's the only thing that we can really recommend for kiddies that age. You probably know this already. So I'd advise you to carry on using that Bonjela. But if he's still not right in the next couple of weeks, then just bring him back.
Okay.
They're all very good, your kids, aren't they? Is it an act?
A cover up.
What do you want me to do for him today? Because I can speak to the first response, okay? If he's feeling suicidal,
I think what we need to do is possibly if you could refer him to mental health team for mental health team to assess him personally rather than on a form.
Okay, I can do that, okay? Are you happy with that? Yes?
Yeah.
Okay. Will you be there for him?
Yeah,
and will
there's
somebody be on
family's
him?
watched all the time, yeah.
I hope you understand the
out,
reason I'm asking
Yeah,
this. And we need to see him again after about 4 to 5 weeks because we are increasing the dose for him.
Yeah, that's fine.
Reasonable?
Yeah.
So we'll see him and I will refer him to the mental health team as well. Happy with that?
Yeah. Yeah.
You agree with that?
Yeah.
Yes?
Yeah.
Because he doesn't talk much.
Because he's really low. We can't let him have sharp objects around just in the kitchen to cook just in case because he gets things in his mind and stuff.
So we'll just do what we have planned?
Yeah.
Is that okay?
Yeah, that's fine.
Is that? Yeah? All right then.
Okay.
All right
Thank
then.
you very much.
Thank you.
Thank you. Bye.
You like doing this? Is this a geeky thing that you like to do?
No, I like doing that as well.
It's quite
therapeutic.
Yeah. So there's 4 number of scripts and 4 on each thing, that's 16 in it. What's 12 times 4?
12
times 4?
48.
If you wouldn't have been here, I'd have used calculator on there. I would have been like,
Bless you.
Hiya, Corny.
Hiya.
Medication review, that right?
Yes.
And how are you feeling in yourself?
Okay.
How many do you smoke then?
I don't know, it varies. When I'm working, I don't smoke, you see.
Right.
Obviously, can't smoke in work, but I do.
What's your job?
I work at warehouse at distribution centre.
Right.
I used to work somewhere else, but I got sacked, so...
All right.
But that really does the atmosphere in me.
Made your chest worse, did it?
Made my chest worse. Yeah. But this is dry.
Okay. So your blood pressure's up a little bit. You see that you'll always be a smoker.
probably, to some degree.
And do you know why we'd like you to stop smoking?
Because of my chest, I know.
Have you tried to stop?
Not really.
No. Can we give you some help to stop? To try to stop? What do you think? And what would get you to that point where you think, I'm going to have to stop now?
I mean, if my chest got that bad.
Yeah.
Like, no.
Yeah. But if we know your chest will end up that bad, if you carry on smoking.
So I should...
and it usually takes
stop.
people, averaging about 7 attempts to stop. So you've just got to keep trying to stop. And the message really is that if you don't stop first time, doesn't mean you'll never stop. Just keep trying to stop. Right, my suggestion is just maybe start you on 1 blood pressure tablet and come back and see me in about 3 to 4 weeks, and then we'll make sure that you're okay on that tablet. But I'd like your blood pressure to be a bit lower. Is that okay?
That's fine.
And do come back and see me.
Yes.
Yeah.
Don't worry, I'll come
Don't
back.
sleep in.
Oh, what sleeping? I never sleep in.
That's all right.
Once my alarm goes off, I'm up.
And have a think about a few of the things we've just been chatting about.
I will do.
And then we'll set up a plan for the future when I see you next time.
Right, okay, thank
Cheers. You take care.
Yeah, you too.
See you, Paul.
Okay.
Pauline.
Sorry, I was in the ladies.
Is it working?
Sorry, yeah, yeah. Oh yeah, I was in the ladies, so I didn't get it. Sorry.
I'm putting it back. Right, I've got
Student again.
so pretty here. A doctor,
Oh,
one of our new
doctor, hello.
doctors who's just learning the ropes.
Oh, bless you.
Right. Pauline.
Yeah. First, there's 2 things. First one, say that still going really well with the tablets. I still feel anxious, still not sleeping well, and I still get moments of just feeling numb. I don't know, I just need advice.
So at first, when you first started the tablet, they helped?
Yes, they did.
They help with
yeah,
your
for the
sleep.
first couple of nights they help.
The fact that you have noticed a positive difference is really good, because usually we say allow it 4 to 6 weeks.
Yeah, so it's been 4 weeks I've been on them now, I think. Still not getting off straight away, but then when I do go off, I have a really good sleep, so that makes a
that
heck
must
of a
make you
difference.
feel
It does.
better.
It's wonderful. The other thing, I've got ulcerative colitis, and I don't know if it's a coincidence, but 2 weeks ago I had a colonoscopy, and since then my tummy just hasn't been right. I've had constant diarrhoea. I spoke to the IBD specialist nurse, and I went to the hospital Monday, took up some stool samples, and they took some blood samples. Still haven't had the results of those back yet.
So before the colonoscopy, they'll have had to give you some bowel prep, won't they, to clear you out? I wonder if it's that then that's sort of aggravated
yeah,
things.
exactly. But it's never... I've had quite a few colonoscopies, obviously, and I've never reacted to it in this way before.
No.
And
That
it's
was
just coming
sensible.
out of me like sludge,
Yeah.
really, you know. It's just not formed at all. The problem is I had to come home from work last Thursday with it because I just couldn't work. I travel on the bus, I don't drive, so of course I
It's
can't...
access to the toilets. It's not pleasant, is it?
No, that's the thing. I mean, I wouldn't dare go for the bus because, you know, it comes on urgently and I have to go. So really I need a sick note, please, for another week just to hopefully get some results back and get back to something like normal.
Of course we'll give you a
Thank
note.
you.
Yeah.
It's just never gone on this long before, you know. It is what it is, isn't it, unfortunately? There's
So
nothing I
think
can do.
You did the right thing by phoning the nurses, so hopefully they'll pick your message up and they should have the results back by the end of today.
Yeah, hopefully, yeah.
I mean, I know they're busy, aren't they? But
That's lovely. Thank you for your time again today.
All right
Much
then, no
appreciated.
worries.
Thank you.
Take care.
I will, and you. Bye-bye.
Bye-bye.
Bye.
My mum wants to get a dog. I said, who's going to look after that?
So I've just got a dog and he's only 7 months. Labrador, yeah. They're just greedy, aren't they?
How's your little doggy?
He's all right.
Oh, have you got enough in now?
No, he's been a little bit naughty this week.
Oh.
I smell something right weird. Have I stepped in? My first ever picking up dog poo experience, which was quite a big thing, really, the first time. And he did a poo on a bramble, a sloppy poo.
It's not me, is it?
But there was someone behind me, so I couldn't ignore it.
Yeah. I'm funny.
Coming in. Hiya, Mr. Russell.
Yeah.
Hi, it's Dr. James. Nice to meet you.
Oh, I've sat down enough. I've sat down enough. I can't
Do you
sit
want to
down.
stay standing up?
Yeah, if you don't.
That's fine, yeah, I'm cool with that. How can I help you today?
I've had a crick in my neck,
Yeah.
but I've also got a bad back.
Right.
I don't know what's happened. I took my dog. I went up to hospital a couple of weeks ago because my dog went through my legs and dragged me over. I badly sprained my leg. It were in that much pain I couldn't walk on it. But I didn't mention my back, but my back's just got worse and worse and worse, and it's really sore and I can't sit down.
And how long ago is it now?
About 5-6 weeks.
Oh right, so it's quite a long time.
It's quite a while ago.
So can you show me which point it's most tender on?
It's mainly this part here.
Okay, I'm just going to gently feel down the middle of your spine first.
Just there.
Okay. Is it there as well?
Yeah, that's it.
Sorry,
That's one.
sorry. And you're able to just lay down on the couch here? Then just let me know if you feel any pain. Right, where's that?
That's just a box.
The bottom there.
Bottom.
About this side? Same place?
Yeah.
I'll let you jump off then, just nice and slowly. Jump off's the wrong word. Just gently step up.
So when I breathe as well, that hurts.
It's all spasmed up, isn't it? And what your body does in response to any pulling injury on your back is it thinks, oh no, that's my back's important, I need to keep it stable and the muscles go really tight. It's almost a bit like a whiplash injury, you know, when you jerk forward and then you get really stiff neck. It sounds like the injury you've had is a bit similar like that with the jerking with the dog. So we could use an anti-inflammatory and that would help bring down some of the pain and some of the tightness a little bit. And then the other thing is, what do you think about seeing a physiotherapist? Is that something you'd be interested in doing?
Yeah, I'll have to do.
There's a drop-in physio here on a Wednesday lunchtime. You can just come in and see, and they'll give you like a one-off kind of work over and give you some exercises. There's your prescription. Okay then.
Cheers.
Take care now, yeah. All the best. You're all right with that. Take care now.
Thank you. See you later. Bye.
Bye now.
Bye-bye.
Come in. Hiya.
Good morning.
Raymond, come on back. How's things going?
All right as such. The rolling pains have gone, but I've still got bad stomach ache. I noticed about a month ago when I went to toilet to poo,
Yeah.
the water was turning an orangey colour. And yesterday when I went,
Yeah.
there were some streaks. I don't know if it's blood or not.
Right, okay. And are you going to, when you go to the toilet, are you going more often, or is it just once a
No,
day?
it's
normal?
twice a day. I usually
Once
go
or twice?
twice a day, and
Okay.
usually first thing in
And
the
how's your
morning.
weight doing?
All right, as far as I know.
You
I don't think I've
You don't
lost
think
any.
you've lost any
No.
weight or anything?
No.
And we've got your blood due today, haven't we?
Yeah, I am had chance.
I know
to
it
be
don't
able-
matter, so-
With work, I am had chance to.
Well, I think the
go.
fact that you think you've probably had some blood, I need to examine your bottom end, if that's okay.
Right. Yeah, no problem.
And then that changes the position a little bit. We might end up referring you for further investigations.
Okay.
So do you mind if I do the bottom
No,
end?
no,
That's great. So if you just have a lie back on there for me.
I'd not thought anything about it. I just thought it was me poo turning water.
Yeah.
It's not clots of blood or anything like that. It was just with me noticing it being streaky yesterday.
Yeah. So what you'd need to do is probably just undo your trousers and your underpants and then turn over onto your left side and lift your knees up to your chest. Is that okay?
Yeah, that's no problem.
Great. I'll just get some gloves on. You had this done before?
No.
Looking forward to it? Nobody's ever said yes yet.
No.
There you go.
With a cough.
Yeah?
Did you say she's got a cough?
Choking.
Oh, Jesus. Ooh, ow.
Hello, sorry about that. You broke up a little bit. Can I help?
Great stuff, that's us finished. Just hang on a second, I'll get out of your way. I think the fact that you've got this ongoing grumbling abdominal pain and the fact that you've noticed probably some blood, we ought to refer you on for bowel investigations.
All right.
Because that means having a look at the bowel all the way around, up from the bottom end.
Right.
And what we're thinking about is making sure there's no polyps. So these are little growths in the lining of the bowel that can bleed.
All right.
And sometimes those polyps can be early signs of cancer in the bowel.
Yeah.
And that's the thing we want to be picking up
Right.
and making sure that we're not missing. So even though it may well all come back all normal, I think it's the right thing to get on and get those
No problem.
investigations done. Is that all right with you?
That's fine, yeah.
Right, we'll make arrangements for that to happen. What they'll generally do is a colonoscopy examination right round the bowel,
Right.
make sure it all looks clear.
Okay then.
All right.
Thank you very much, and thank you for
nice
your
to
time.
see you again. No, don't
Thank
worry,
you.
Raymond, thanks. Well, I'll just walk you down to get your bloods because Jess is waiting for you.
All
We
right.
can get you
Oh.
sorted out in one go, can't we?
Yeah, sorry.
Yeah, you follow me.
Sorry about that. I had to
Sorry,
go and
mate.
review a patient next door.
Absolutely fine.
Right, so I'm Dr. Khan. How can I help?
What it is, I can't walk on my heel on my right foot.
All right, yeah.
Don't know what I've done. So I thought I'll leave it a couple of weeks, I'll take some anti-inflammatories, get it down, and it hasn't gone.
Yeah.
I've had ice on it, everything, nice baths, no
working.
taking it down.
Let's take a look. So show me where you get the pain.
Just right in that area, just in that full area there. So every time you touch it, alert.
Yeah. And just remind me what you do for work. You say
I'm a drainage operative.
Are you on your feet a lot?
All day.
Yeah.
All day long.
Okay. So I think you've got a condition called plantar fasciitis. Have you ever heard of that before?
never.
Right. So let me just show you what I mean. So this is the plantar fascia, that lining of tissue that runs under your foot.
Yeah.
And that's the bit that can become inflamed.
That's what's hurting me.
Yeah, yeah. And you can see it's exactly the place where you're getting the pain, really. So you've done the anti-inflammatories and the resting side of things. The next step is really trying to get that more elastic again by doing some exercises, which I'll show you. If the exercises with the painkillers don't work, the other option is then to think about injecting it with a cortisone to try and loosen it up, which is a really powerful anti-inflammatory.
Okay.
So you can see these pictures here.
Yep.
We have to stretch it out really. So you lie down with a cloth, lie on the floor, and you pull your toes back.
Pull your toes towards you.
Because what that plantar fascia links into is the tendon at the back of the heel as well. So say this is the foot that's the problem.
Yes.
And you pull in there, and what you feel is a stretch all along there.
So
and
basically all you're doing is stretching your calf muscles.
yeah, because you want to
straight.
pull it up really.
So that, yeah, okay.
The other thing is this. This is a really good one, but you use a tennis ball rather than a rolling pin.
Yeah.
And you just roll your foot back and forth over a tennis ball. And if there's any
Like a
inflammation-
massage?
Yeah. The thickened bit will start to break up and then soften. So I'll just print this off for you.
Brilliant.
It's a really common condition, so don't worry about
I
it,
won't
and it's
worry.
easily treated.
Right, thank you very
All
much,
right.
sir. Yeah,
Okay,
cheers.
thanks for
Ta,
coming in.
thank you.
Cheers. Take care.
Janet thinks I've lost a pound. And see how I've been trying this week, really.
That's good then.
That's all right, isn't it?
When you've lost a pound and you've been really good, you're like, a pound.
Yeah.
But then when you might been that good, you're like, a pound! Like, it's never acceptable.
I remember I went and I'm like, I've had a really bad week and I'd lost £6. I'm like, has your scales got problems?
What? That's never happened to me.
I have no idea what were going on. How did I do that?
How have you been? Good. Come and take a seat. Last time we weighed you was November 2017. You were 13.10. You're now 12.11. So
Wow.
stone off. Is it anything to do with cake?
Yes, I have stopped baking.
So you've had all your bloods done for your diabetes?
Yep.
How do you think you've done?
Well,
okay.
Because I'm very careful.
Okay, your sugar now.
Pre-diabetic.
Yes, 39.
Nice.
Yeah. Cholesterol, 2.5, excellent. Kidneys, excellent.
Good.
You're getting a gold star.
Ooh.
Right, you're on a lot of tablets, aren't you? Losartan for your blood pressure. Lansoprol for your stomach. Bisoprol. Amitriptyline. Yeah. Sitagliptin for your sugar. olive oil for your ears, pregabalin
for the pain, joints,
Laxido, constipation. You've got inhaler, Fibrogel, ibuprofen, Manivec, Torvastatin for your cholesterol, Mebeverine for your tummy, mood tablets.
Yes.
Okay, so we might need to take a tablet out. I'm just doing yours now. Please stop glimepiride 2 milligrams as hypo risk. And excellent diabetes control.
Ooh, I'm gonna go eat all the ice cream I can find. No, I'm kidding.
Did they ask you to bring a urine sample?
No, I keep forgetting also.
Okay. If I give you a bottle and a form, will you be able to do it?
Yeah, I'll be able to bring it back.
All you need to do,
just put it.
Leave them in there, put your urine in there, drop it back at surgery. So it's lovely to see you.
Yes, and
everything's
tell your
really
boy
good.
Happy birthday for me.
I will do.
The best people are born on our birthday.
So let's see you before your birthday, yeah?
Okay.
Kidology.
Next year?
Yes.
Wow, a whole year?
Yeah, a whole year. If you find that sugar starts to creep up, come back sooner. Yeah. But I think you're going to be fine.
You look after my
And you.
for me.
See you later.
Yes.
Bye. Bye. Go that way.
Oh, okay.
Bye.
Bye-bye.
Let me get the dog for you. Bye-bye.
Cheers, mate.
Take care. Bye.
It's nice meeting you, love.
Nice meeting you too, honey.
Have a good life. Stay as you are. Thank you.
You too.
If I could see patients all day, every day, and not have to do anything else, I'd be a happy woman. Have you spoken to anyone to try and get some help?
I don't think speaking to anyone will help.
The problem with prostate symptoms in men is that it's quite embarrassing in their eyes to come in for the intimate examination. Would you mind if I examined your prostate today?
I love working here. Every 10 minutes, I can make a difference to someone's life.
I've tried to take my life so many times.
Nothing seems to be curing it, really.
I do smoke a bit of puff.
What do you mean by a bit of puff?
A bit of marijuana.
Your 10:30 is late as well.
OK, I mean, I can see the son now then, because he was the first appointment.
OK, thank you. Right.
Gordon Runham. Right, just take a seat. Right, so how can I help?
I don't know how to say it, like, you know when you get dizzy, yeah? But not dizzy, like lightheaded.
Like unsteady? As if you might fall down?
Yeah, like lightheaded, like it's not, I'm not getting enough blood or oxygen to my brain, you know what I mean?
OK, and is your vision straight?
It just feels like a bit distant, you know, like when like it feels like I'm gonna pass out.
Really?
Like, when I breathe in, it's not. That's when I get it. Like everything becomes a bit tight on my left-hand side of my
Oh, right, OK. But it's mainly when you breathe in. Okay, just have a listen to your heart. Deep breath. And out. And out. Good. Just take a seat there. Relax while you're having your blood pressure done. I'll explain it to you. That's good. So, what happens when people, particularly young patients who are fairly fit, breathe in, the heart rate slows down. And when they breathe out, the heart rate speeds up. And it's called sinus arrhythmia. The amount of blood that each heartbeat pumps out is bigger. Your heart beats less often. Your blood pressure also might fall slightly, and it might give rise to this slightly lightheaded feeling. So your heart rate slows from about 72 when you're resting, and when you breathe in, it slows to 60. Right. And then when you breathe out, it comes back to 72.
Right.
Roughly. But it isn't abnormal. If you don't understand what it is and you become anxious about it, that
makes it worse.
effect can be magnified. That's right. That's all it is.
So what's the dizzy? Why do I feel like...
It's because when your heartbeat changes, there's that lag period where it catches up in terms of glucose and oxygen in your blood to your brain.
What about the breathing as well? Is that just a bit me being anxious?
Correct. That's what it is.
Yeah,
so in this situation, it's a normal phenomenon. Our job is to distinguish between something that is important and something that doesn't need any medical intervention and isn't an indication of disease.
Yeah, is that it sorted?
That's it.
Cheers, Doc. Thank you very much.
Yeah, nice to see you, yeah. Yeah, you take care. Bye.
Hold it. Hello, how are you? I'm feeling good. You're feeling good? Yes. Why are you here? You sleep there? No, I don't tend to sleep there.
He has a bit of a cough. It's been on and off for a few days. And it's just it's starting to get a bit deeper, a bit more pronounced.
Has he had a fever, do you think?
No, not really. Just a cough.
And what about eating? Is he eating okay?
Not really. It's just less and less.
Has he had chest infections or anything like that before?
Yes, yeah, when he was a lot younger, perhaps 2 or 3.
Do your ears hurt you? Are your ears okay?
Yes, my ears okay.
Okay.
And my nose and everything.
Everything's okay?
Yeah.
Well, that's fantastic. Can I just take your temperature? It ticks like a clock, all right? That's fine. I didn't hear it ticking, though, did you? It's all right, though. I haven't got a fever.
What's that?
Just takes your temperature.
Is it my brain? That's my heart.
Your heart's on the other side there, look.
Yeah.
Yeah. Can I just put this on your finger? It doesn't hurt.
Tickles.
It tickles. I'm checking oxygen levels in your body. That looks fine. Thank you. Can I look in your ears? You look very smart today.
That's so tickles.
Can I look in the other one? That's it. Pop your tongue out. That's lovely. Well done.
Do you check my heart?
I'm going to check your heart, if that's okay. Oh, it's a bit of a tickle.
Do you hear that?
I can hear your heart, it's fine.
No.
Again. Yeah, he's got a chest infection. Now I'm going to tuck your label in, all right? So he needs some antibiotics. Okay.
I got a chest.
You have got a chest infection.
Hello. Sit down, please, lad.
Okay.
Take that.
Thank you, Dad.
So it's going to be 4 times a day, okay?
So do you reckon it'll be a bit advisable just to keep him in today?
Yeah, I'd keep him at home.
Sure.
Have a nice rest today, yeah?
Yeah.
You've got a cough, haven't you?
Right,
It's lovely to see you, and I hope you feel better soon.
Bye.
Okay, good boy. You've been fantastic.
Thank you
All
very
right,
much.
thank you.
So just go down, quick, pharmacy down there.
Pharmacy's just down there, yeah.
Thank you.
Bye.
Samantha Holmes. How are you?
I can't take this anxiety anymore.
Go on.
just this constant feeling of doom and just my chest feels really tight. And those pills, I was hoping that they would help, but
What's made things so bad?
there's nothing that's triggered it. It's just, I don't know. It's horrible because I'm constantly feeling like jittery and when you asked before if I had suicidal thoughts and stuff, I said no because I didn't want anyone to think that I'm some nutcase, you know.
Mm.
But I used to self-harm and stuff. Yeah.
Have you done anything recently?
No, I haven't done anything in a while.
So what sort of thoughts are you getting?
Just... I just feel like if I wasn't here alive, things would just go on smoothly and there would be no problems.
How are you doing from the point of view of diabetes?
It's my blood sugar level was high.
And it's high again.
Well, it's funny that.
Diet-wise, are you conscious about what you have, or...?
Cut down on my beer, cut down on bread. I've had no sugar for 9 days on my cereals.
I do cheat every so often and have a sweet. Yes. Do you have alcohol, sir?
As much as I can get down my neck.
If your blood sugar went down
and you feel a bit wobbly and a bit dizzy,
you would know that you need to get a chocolate bar.
Some jelly babies.
Don't tell me to lose weight because it's not happening.
I have lost around 9 kg.
Well done you there, you're amazing. I'm really pleased. Richard Baker. Come and take a seat. So, how are you?
I feel a lot better than what I did.
I'm not surprised. Your sugar's very much better.
Oh, good.
So, when I saw you February time, it was up at 113.
Yeah.
Up here.
Yeah.
It's now come back down to 84.
Oh, so it's...
So those tablets are working?
Yeah, good. Yeah, I lost a little bit of weight when I first went on them.
That's right.
But it's evened out a bit
Oh, right,
since.
OK. So no problems with the waterworks with them?
I've still got the problem of getting up too much at night, but nothing otherwise, I think. Yeah.
Good. Shall we do your weight? Well, just to see what it's doing, don't worry. So take a kilo off for your shoes. So we say 113. Wow, you've lost 5 kilos, so that's about 11 pounds. That's really good.
That's more, yeah. Well,
that's very good.
From scales, yeah.
And you'll be feeling better as well because you've lost the weight.
Yeah.
OK. I think it will continue to come down, you know. I really do. You do look very much better. Losing a bit of weight at your age, it helps with your joints, helps with your mobility. It just generally makes you feel much better, so...
Yeah. So the only concern I got is getting up so much at night.
How many times are you going in the night?
I get up about an hour and a half after the first time I go to sleep.
And then how many
And
times?
then it gradually extends 2 hours, 2.5 hours.
The prostate warning signs are mainly to do with how you pass urine. Men will notice going to the toilet more often than they normally do. When they go, they're not passing as much as they normally do. Or the stream isn't as strong. They'll also find that they are getting up several times in the night to pass urine. Would you mind if I examined your prostate today?
No, that's right.
The problem with prostate symptoms in men is that it's quite embarrassing in their eyes to come in for the intimate examination. They don't like to admit that they have a problem. And if we catch prostate cancer early, we can cure it. So I would like to say to all men out there, if you're having symptoms, please come to us. All right, take a deep breath. All right. That feels smooth, so that's good. Let me just wipe the gel off. It's a few seconds of embarrassment and then it's over and done with, and we could change your life. We're all done now. Just get up carefully, don't topple off. Okay, you just sort yourself out. So
I'll put the request on the computer for you to have the prostate blood test done, but book that in for a week, 10 days' time.
Yeah.
Is that okay?
Yeah.
As regards your diabetes, we'll see you again in 6 months.
6 months?
Yeah? I'm ever so pleased.
Yeah.
Really, really good. And you look really well, which is great.
Yeah.
Obviously, being up north is good for you as well. Yeah.
Right,
Take
thanks
care of
very much.
yourself. Bye-bye.
Come through.
That's okay.
So you're...
I'm going to sit there, yeah? Righto.
Okay.
Yeah, I was referred to by Dr. Butt from Weeks Drive surgery.
Fine.
So it's to do with that.
Okay.
I used to suffer from acne, and I've always had like a little thing there. And I was shaving one day, and I must have got some dirt in it, and I've never bothered about it.
Yeah.
I just wondered if you could
Yeah,
possibly get rid of them.
I'll see.
Or give
what
me
I can
something.
do. Yeah, okay. So do you mind if I feel around the area and just
Of course
see?
you
Does
can.
it cause you any pain at all?
No.
Have you tried squeezing it?
No, I didn't want to.
It looks like there's a keratin plug in there.
Yeah.
And from looking at it on the surface, it looks like something called a comedo, or comedone, basically, is where you can open it. And it's sort of like an open pore. So what I'm going to do to make it more comfortable for you is get you to lie on this couch.
Oh, right.
Yeah.
You can have a go at it, are you?
I'm purposely not going to cause you pain. And if I do, then you must tell me to stop.
No.
All right? Okay, so lie on your back.
Yeah, okay.
And this is more for me to get an idea of.
Yeah.
But occasionally this is...
Yeah.
It can be quite useful to get an idea of what the consistency. So in that area, there is sort of a firmness.
I'll tell you if you hurt me, but you carry on.
Can you see that's sort of the area where there's sort of this sort of plug inside the middle? You can sort of squeeze and take these things out, but is that causing you pain?
No, I had an itch. It's all right, carry on.
You had an itch?
Yeah, go on, carry on.
So I'm just trying to see. So this can be, there are different ways, but just trying to see. So you can see there's sort of one of them. Now this is something you can quite safely do at home. Is that causing you pain?
A little bit, but if you can get it out, I'd rather go through the pain and...
Because this might be difficult. So over time...
It's probably better that you're doing it rather than me.
So you can see this sort of keratin consistency coming out.
Okay, yeah.
So you feeling okay?
Yeah, I'm all right.
I haven't done very much. It was more just to see what consistency was in, and you can see that.
Yeah.
But if you kept doing that over time, it will tease itself out.
It'll come out with it. Okay.
There are some things that I can give you that can sometimes help break down that area.
Yeah.
What I've given you there is a dapaline cream, which
Yeah.
is to be put on at night time.
Okay, fine.
If you find they're becoming very painful and nothing's
No,
progressing, then
it's
come
all
back
right.
to
It hurts
us.
a bit now because you've been squeezing it.
Yeah,
That's all right.
I'm really sorry.
Don't worry about it.
Bye-bye. Thanks for talking to Patrick as
That's
well.
all right.
Thank you.
Okay,
Bye.
Thank you, Chris. Anyway, have a nice day.
Morning.
Tierney O'Shea, please. Hi there.
Hi.
All right, sorry for the wait. I'm Dr. Taylor.
Hello.
How can I help?
Well, it's coming up to 7 weeks now that Tioni hasn't had a voice. She had a terrible cold, very, very sore throat.
Yeah.
She was given antibiotics because it was on the verge of tonsillitis.
Okay.
Swollen tonsils. And then it went into laryngitis just after that. I brought her back. I was told it would clear.
Mm-hmm.
Still nothing seems to be curing it, really.
Is it still sore? Okay.
The only benefit she says that she has is when she's in lessons, she doesn't have to answer questions.
Shall we have a look? So you're not having any fevers at the moment, otherwise you feel quite well in yourself? Yeah. Just going to have a look at the back of your throat. You know the drill.
Not nice, I know, darling. Bless you.
Can I have a look in your ears as well? Okay. And the other one? Press that into your neck. Is that sore? No. Okay. Just have a quick listen to your back of your chest as well. Do you want to just turn around? Okay. So, your throat doesn't look too bad. Your tonsils aren't up. There's a little bit of redness at the back there, but otherwise it looks okay. And your chest sounds fine as well. So I think you're right. I mean, this classically sounds like laryngitis. Obviously, it's quite prolonged.
Yeah.
To be honest, at the moment, apart from it being laryngitis, I can't really think of anything else that I think would be more worrying that we need to be ruling out here. And in the absence of any pain there or any obvious swelling of the tonsils, it doesn't look like there's any active infection
Right, okay.
there. And I think what we're seeing is the aftermath of the infection that was there
Right,
just over a month ago. The only other thing that potentially we could do is get an ENT doctor, so an ear, nose and throat specialist, to put a camera down the throat and make sure that there's nothing else going on down there. But that would seem a bit mean for something that I'm pretty sure is still just the after effects of a virus.
I understand that.
Yeah.
But obviously this is going on for so long and I want it looked into further to see, you know...
Do we have your correct contact details?
Yeah. Okay.
All right.
That's great, Doctor. Thank
No
you
problem.
so much.
Take care.
Bye-bye.
Bye.
Don't feel so hard on yourself. You've done a great thing by looking after your mum. You are doing a great thing. And what about in terms of supporting you and with everything you have to do?
There's nothing I can say or pinpoint that says, OK, that's what's causing my anxiety or, you know...
It's just everything.
Yeah.
Yeah? OK. So you're going through a bit of a tough time. But it will get better. If you want it to. You want it to get better?
Well, of course I do.
Okay. So you don't think talking to anyone will help? So I take it you didn't call talking therapies?
Mm.
Okay. So what we're going to do about your medication?
I don't know.
Sometimes there's another medication that we can use, which doesn't really help with what's going on up here in your brain, in your head, but can help with the physical effects, so that actually just calms things down a little bit so you don't feel so heightened anymore. And we can actually give it in conjunction with the fluoxetine. Do you want to give that a go?
I'm willing to try anything at this point.
Will you come back and see me in a few weeks? Yeah. Okay, because I haven't seen you in a long time. You've not touched base. And I'm going to ask you again. Got any plans to do anything silly?
No.
Okay. Do you need some more fluoxetine?
No, I'm fine with that.
So I'm going to ask you to take 3 every day, and then I've updated your records so the next time that you ask for one, you can have some more, okay? I want to see you back in a couple of weeks. So don't worry. We're going to be all right. You're going to get through this. And you're going to start feeling better soon.
I've heard that so many times.
Okay, let me rephrase that. If you want to get better and you want to start feeling better, then you will. It's just going to take a bit of time. Okay? So keep talking to me.
Okay.
No more going off. All right?
Yeah, thank you very much.
Take care. Antidepressants work for some people and don't work for others. Given the right support, given the right psychotherapy and positive enforcement and encouragement, people can recover.
Yesterday I woke up with my ankle was swelled up in it and it's very hurting every time I walk.
But you're not registered with us yet?
No, I've only just moved there.
Would you know where Upton Walking Centre is in Slough?
Would you be able to put me out for a little map?
So, how are you feeling? How are you keeping with regards to your chest?
Yeah, not too bad. It's still alive. I do have a cough, and I do cough loads out, especially if I'm waiting to go to bed and I take my inhalers. Oh, mate, does that clear your chest out?
It's just part of the disease process, COPD. It's just because of damage to the cells in the airways, they do produce more
mucus. Keep drinking plenty of water, because if you get dehydrated, it can be quite difficult to bring up because the phlegm dries out.
This don't trust me.
Yeah.
I drink about between 5 and 8 cups of tea, in big mugs, every day, guaranteed.
Good. So how many are you smoking now, Michael?
I've had 3 or 4 so far today, roll-ups. I do smoke a bit of puff still.
What do you mean by a bit of puff?
Bit of marijuana.
Oh, right. What colour's the phlegm normally that you bring up?
Green.
How's the breathing though?
Terrible. Tube in mouth, pinch your nose, and then just blow out nice and slow and steady. That's it. Keep going, keep going, keep going, keep going. As much as you can. Squeeze it all out. Good, well done.
Was it? I thought that was rubbish. What we should probably do is change that nasal spray to something different.
Gunpowder.
Gunpowder, yeah.
Sounds a lot better than last time.
That's probably because I cleared it all last night.
Yes.
Cough, cough, cough.
I've had it so long, I could just put up with it. But at night, I do like a puff before I go to bed, then I could go into sleep.
That helps you sleep.
Yeah, it's the only thing, yeah.
So relax, blow first. So big breath in, tube in mouth, pinch your nose, and blow out nice and slow and steady.
I can't breathe out my nose anyway.
Oh, right, okay. That's it. Keep going, keep going, keep going, keep going, keep going, keep going as much as you can. Good. Right, try and get it right in your mouth. You seem to be pursing it a bit sitting it on the end of your...
I thought I was kissing it.
Yeah.
I know. I'm too much of a gentleman.
Right, go on then. That's good. Keep going, 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 keep going.
Nothing left. They're empty. No more.
No, that's fine. No.
You made my day, thanks.
Okay. So,
Did I pass my MOT?
well, it is a bit worse, I think, than last time, Michael. Your ability to blow out the full volume is the same. It's just your ability to blow out forcefully that first second that's gone down. You know, I think the only thing that you can really do is to stop smoking to try and stop this from getting any worse, really.
Yeah. I don't even want to take that vape thing, really.
No.
That's
Have
what I don't
you done the pulmonary rehab course, Michael?
No? What's that?
It's a 6-week course at Upton Hospital, and then they'll give you lots of different exercises, techniques to cope with your breathlessness.
How long are you in there for each time?
2 to 4 hours, I think. So
2 to 4?
Yeah, I'm not quite sure, but...
Go on then, refer me. Okay
good.
then, Doc. Thanks, Julie.
All right, so keep...
Okay.
yeah.
All right,
I'll refer you to pulmonary rehab and, yes.
Rehab, I
Keep-
like that. Thanks
All right, take care, Michael.
Fill me in. How are you?
Well, to be truthful, I couldn't write anything down because it doesn't bother me.
Okay.
The only time
This is the prolapse we're talking about, yeah?
Yes.
Yeah. Yeah?
The only time it bothers me is when I pass water and wipe myself. I can feel it, but not every time.
Louise is one of my patients who is 91. She's a sprightly 91-year-old who has seen me over many years, really, for a prolapse of the uterus. If this were the uterus, that's the body of the uterus or the womb. This is the mouth of the uterus or the cervix from where the smear is done, for example. Occasionally, when the supports are weak, the uterus can actually descend down into the vagina, sometimes to the external opening of the vagina, and can even be seen outside the vagina in very severe cases of prolapse. So let me just recap. You had a ring pessary for the prolapse, and then every time we had a problem, such as a little bit of bleeding because the ring was causing you a problem there, we took it out. The treatment of a prolapse uterus varies depending on the degree of prolapse. So we would send them for physiotherapy. If physiotherapy doesn't help, there is an option of surgery available, but there are some women who actually don't want to have surgery. In that event, we can actually offer a ring pessary to a patient. A ring pessary essentially is like a little bracelet. It's made up of PVC or plastic, and it sits in the vagina, at the top of the vagina, supporting the uterus.
I mean, is there any harm in not having it in?
Not at all. This is why I said to you last time that let's do this exercise where without the ring pessary, you can actually then decide, is this prolapse really bothering me? And you've just said that it actually is not troubling you that much. Put anything in there.
Does it get any worse?
Very good question. So the prolapse can get worse if you get constipated.
I am trying, because I have piles and that causes me other...
So are you constipated? Are your stools hard?
No, I'm not, because I take lactulose.
Perfect.
Yes.
So make sure that you do not get constipated.
Yes.
Take the lactulose regularly, because when your stools are soft, you're not straining to pass stools.
Yes.
And when you're not straining, you're not pushing bits of the vagina further down.
No,
okay?
I understand.
Obviously, don't lift heavy weights, but I don't think you're going to be going around lifting heavy weights. And of course, if you had more children, you might.
I don't think I will now.
You don't think you're going to have any children now, so that's exactly.
What I was going to ask, my sister wants me to go and see her in Canada.
Okay.
And with this, I'm a bit concerned.
With the prolapse?
Yeah, would it be all right?
Yeah, perfectly. It's not going to bother you on the flight, because when you sit down, it doesn't bother you.
No, that's right.
It's not really going to get worse. So long as you take all your medications, take your lactulose and make sure you're not constipated.
Definitely.
So I can't see that being a problem.
Oh, right.
You just need to relax and have a good holiday.
Thank you.
Yeah, absolutely.
Thank you very much, Doctor.
It's always a pleasure to see you.
Come on in. How are you getting on?
Oh. Life's just it's just dragging, it's boring.
And the weather doesn't help, does it?
I can't do anything, I just feel trapped in my body, you know what I mean? Really do.
You'd recently had your procedure done with a gynaecologist.
Yeah. From the operation, would I get any infection from that? Having utensils as such put inside me. I felt a bit uncomfortable and a little bit sore afterwards, and I still feel a little bit twingy now.
Yeah.
A little bit,
I think if you had an infection, you'd probably know about it. Often you get sort of quite severe pain or a lot of foul discharge.
No.
So if that's not really happening, it's unlikely.
A little bit,
yeah.
A little bit sore, a little bit itchy.
Thelma had a hysteroscopy recently, a procedure that a gynaecologist would do, where they essentially have a closer look at the inside of the womb and look at the health of the lining of the womb. They use a small camera on the end of a telescope. In Thelma's case, they also did a biopsy, which is where they take a sample of the lining of the womb and send it off to the lab just to make sure there aren't any cancerous changes, for example, in the cells of the womb. And is itch around the vaginal area?
Yes.
Okay. I mean, one thing we could try, because it sounds like this potentially could be thrush, for example.
Yes.
And that's often what causes itching. I could give you something, a cream and also a pessary to put inside.
Cream and pessary is no good.
No?
I can't exert them.
Right, okay. I can give you a tablet.
I can't bend. Yeah, a tablet would be fine.
Yeah?
Yeah.
Okay.
There's nothing I can do to get there at all. Bending is out of the question. Because I've just had last year a toilet, I think I told you, I had a special toilet in my house. For £3,725.
And what's special? And what's
special about it?
So is it a?
You asked me that. Well, you sit on it, so it washes you, and then as soon as you stop your elbow, the one. So
Okay.
it dries you. Little hand comes
That
out.
sounds very high tech.
It's amazing. I love it.
All right. So that's the tablet for the.
Lovely. Just stop being comfortable.
Yeah. So it's just a one-off tablet. All right. It was nice seeing you again. All right.
Okay. Thank you.
Take care.
God bless.
All right.
Yeah.
You know that clock in the pharmacy?
Yeah.
At Welsh Dragon?
Yeah.
I bought that.
Did you? Oh, it's lovely.
How can I help you today?
I lost my friend about 4 or 5 weeks ago.
Oh.
I haven't been able to sleep since.
Was she a close friend?
My best friend for 35 years. So I can't sleep at night very well. I keep getting bad headaches. My body's all hurting. I've got osteoarthritis anyway, but I think like with the stress, my whole body's hurting. Like some days I can't just walk.
Have you tried some physio for this joints pain? Have you been referred to physio? Looks like it's been going on for many years
No, I've
now.
had this like for about 10 years. There was a stage before they actually found out what was wrong with me. I couldn't walk.
I can see that you were referred to physiotherapy quite a few years ago, and then
Yeah, it's quite a while ago.
2012. Might be worth doing that again.
Okay.
But with regards to your sleep, it's easy to just give you a sleeping tablet, but that's not going to help the situation.
I'm trying to get over it. It's hard because she was part of my life every day.
Do you think you need some counselling? That's something you could probably try. You can self-refer.
I suppose I could, yeah.
So they do bereavement counselling. Shall I give you the contact details of the talking therapies?
Okay.
Yeah, and then you could probably contact them directly because you don't need a doctor's referral.
Okay.
We need to address the primary issue. So counselling might help if you're still struggling. They do bereavement counselling separately. Yeah. So I'll give you the number. And you can self-refer. All right. Take care. Be strong. You've had many good years with your friend.
Very good.
Yeah. So you have a lot of good memories to cherish. And everyone have to go, but it's the way how we deal with the loss, isn't it? It's difficult, but they say time is a healer. Okay, be strong. All right. Okay, Chan, you take care.
Thank you so much.
You're welcome.
Thank you.
Take care. Bye-bye.
Thanks a lot. Bye.
Just give me 1 second. Excuse me, ladies. Hello? Any help out here, please? Thank you.
How can I help you?
Doctor, I've been bleeding.
Okay.
I am so desperate. I need something to help me.
When you say you've been bleeding vaginally? Vaginal
Yeah.
bleeding? Okay. And are you bleeding very
this-
heavily then?
Yeah, because I've had 2 different types of medication prescribed.
Okay.
But I think none of them have actually worked for me.
Okay.
I am so desperate. I am dizzy. I am weak.
Okay.
My problem is because I've been bleeding for, it's almost 2 months now.
Yes.
And, I tend to get sore.
Yes.
So I feel like I'm losing so much blood.
Okay.
So that's where my concern is.
That's your worry, is it?
Yeah.
Okay. Well, we did do some blood tests recently, and they were okay. They showed that you weren't anemic. You weren't losing too much blood. Okay. Let me just check your blood pressure today. Make sure that's okay.
But doctor, do you know why I'm so tired, so dizzy, and all that?
That might be to do with the bleeding. It might be the hormones. Okay. Do you have much stress?
Yeah, kind of.
Stress is something that can make people feel very tired. Where is the stress coming from, do you think?
I've been on the medication for a long time. I've been on medication for a very long time. But I stopped it myself because I thought, maybe the medication were not working and I needed to, just say to myself, maybe I can do it. But I think sometimes at one point I get discouraged, and I've tried to take my life so many times.
So you're getting really anxious.
So I get really anxious.
I was in an office, I had to let go. I was in liability on my painkillers. I was not well. I had to let go.
My anxiety's dropped a lot.
You're not feeling as panicky?
Not as bad, no.
Do you have to ask about things like self-harm and nothing like that?
No,
Okay.
she's got it all under control at the moment.
You've been okay on the higher dose? It's not upset you?
I'm actually laughing
and coping.
It's not as bad as it used to be, but sometimes I really get to that point where I feel like going back to that stage, but I try to put myself together.
Well, even if you don't feel as bad as you used to, and you don't necessarily feel like taking your life, you can still feel tired and down. And
Yes,
just because it's
I
not as
feel
bad
down.
as it was doesn't mean to say it's not causing you to feel quite tired and weary a lot of the time. That's probably the cause of you feeling like that. But we can do some more blood tests just to make sure you haven't got other vitamin deficiencies, other diseases that we've not tested you for. Your blood pressure is actually okay, so you're not losing too much blood to make you faint and dizzy.
Is there nothing else? I am tired of, I'm so sorry to say this, but I'm tired of wearing pads.
So let's go back to the medications that you were prescribed then. Did you try, how long did you try the tablets?
The first one, they asked me to take it for 7 days, but I took it for more than 7 days because I had to take it because it was still, you know, but at one point, it was working. Okay. At one point, I thought it was going to stop.
Yes.
And then it started again, and then I took the rest of it.
Yes.
So I thought when I finish it, it's going to stop. Then it stopped, and then started again.
Okay. So we could put you back on that one? Would you like to do that?
But this second one hasn't worked at all.
All right. Let's go back then to the one that did work. Okay, so just start taking that every day.
All right. I'm so grateful, Doctor. Thank you.
Okay, and keep taking them then until after your appointment.
Okay, thank you.
Okay.
Thank you, Doctor.
All right. Okay, thank you.
No.
No. But
I'm in here. Come and take a seat.
Thank you.
Right, mate, what can I do for you?
I've got a problem. I think I'm getting like some kind of flu or illness. The biggest problem is my throat because I feel quite a big pain when I'm trying to swallow.
How long has it been like that?
About 8 days now.
8 days?
Yes, I've been taking some tablets, paracetamol recently.
Stand up for me. Open up wide. Dreadful. Yeah, I agree.
Obviously, I just come back from the holiday.
Oh, have you?
I just start feeling really, really bad.
Have a stand up for me again. Just want a quick feel. Are you coughing much or not?
No, not too much now. I just feel the pain when I try to swallow.
Your throat is really swollen, it's really inflamed, and you're developing little bits of pus on the back as well. So you're getting like a tonsillitis, if you want to call it that.
Now, so it's a bit better.
Okay, so have a quick listen to your back. Okay, deep breaths through your mouth. In and out. And one more. Good. Okay, pull that down. Let me just take your temperature. Yep, so you got a high temperature. Your throat looks terrible.
Thank you.
That's the good part.
That's good. Okay, what's the bad
Okay, the bad part is we can do something for you. Okay, this always starts as a virus, but sometimes when you start getting all these bits at the back, then we think you may have the bacteria on top. I'm going to give you an antibiotic for that because I think it will help. Yeah. I want you to keep going with lots of fluids. You must drink a lot because you're losing fluid. Yeah, you're losing fluid because you're so hot. Okay, you're sweating and things like that. You can buy all sorts of things over the counter, Difflam, things like that, which is quite good to gargle with because it will help with some of the soreness at the back of the throat. Or you could just take plain paracetamol or something along those lines. Yeah.
I'm all the time taking paracetamol stuff.
I think you may because it will bring down your fever a bit. It helps for a while and then it comes back again. You're not allergic to anything?
No.
No. I want you to take 2 of these tablets 4 times a day, okay, and that will last you for about a week, yeah? And we'll see how you get on.
Can I buy them in the pharmacy over here?
Was it a good holiday, or did it rain all the time?
No, it was quite good. The last 2 days was nice weather, as you can see on my face. Because I went to sleep on the beach. So
oh, did you?
That's why my legs also are so red, you know?
Yeah, another reason why you're hot, mate.
Probably. Thank you very
Try
much,
those.
sir.
Okay.
Okay, have a good day then, yeah?
See you later, bye-bye.
Cheers.
He's a little devil. My cat.
Your cat?
The cat bit me and it came up really high last night. And he catches a lot of rats. It was all puffy through it. But it's full of scars with him.
So have you had a tetanus injection lately?
It's been a long time, I think.
Yeah, it is definitely. 2004?
Oh, it was. I think that's when my other cat, I was playing with him, scratched me in the eye.
2004 is when you had the tetanus, yeah. So we can do that today. And some antibiotics there. Yeah?
Okay.
So just give me a second. Yeah, just wait for me there. I've got Dr. Aaron here to have a look.
Oh, yeah. That's where they always get you.
Yeah.
How old's the cat?
He's 10.
Yeah, and then the teeth carry quite a lot of bugs when they get older. So we need to cover it with what we call a broad-spectrum antibiotic, which is augmentin. Are you allergic to any antibiotics?
No.
Okay, so let's do it now and I can sign it. If the swelling gets worse, if you get any tracking up your arm, we need to know.
Okay. Devil in here.
All right,
And
take care.
And I'll grab the vaccine.
Okay, thank you.
All right,
Yeah.
bye.
Devil.
You take care. Okay, you're welcome.
All right, take care.
Bye-bye, Adriana. Nice to see you.
Bye.
See you then.
Fingers crossed.
Yes, very much so.